And you said, that's probably why you had trouble getting pregnant. A lot of our audience members, I believe, are going to be guys that were in my situation, that feel confused and desperate about the fact that it is on them. You said, is it the stat 50% of...
If you look at troubles trying to conceive, half the time it's female, and half the time it's both, and a third of the time it's just male.
They just need a sperm for that. Right? The story here is that I was never given a physical exam, and yet I went through months of infertility and spent a lot of money. I know that it's...
A third of the time it's the male problem.
Right, but they didn't even check. They just needed me to jerk off in a cup, which I did well. Welcome to the very first episode of Talk with Turek. It's a podcast about men's fertility and sexual health. And my name is Rob Clyde, and this is my good friend, Dr. Paul Turek.
Hi, Rob Clyde, good friend.
This is crazy that we're finally doing this.
I know we do these over dinners all the time, but
right?
We're now sitting in front of a formal atmosphere.
A formal atmosphere. So,
but not really. We're not formal.
We're not formal. We have been kind of talking about doing this for about 6 years or so, pre-COVID, and we're going to tell everybody out there kind of the why, what, and how of Talk with Turek. And
there's a lot we don't know about men.
Exactly, and men don't know about men.
Right. And I've been studying them as a species for 30 years.
So the purpose or the roles that we're playing on this show, we're playing roles.
Okay,
you're the scientist.
We don't normally do this, Rob.
Role playing?
Right.
Right? Well, we can talk about role playing on episode 15. Okay, it'll be all about sexual health. Okay, but the roles that we're going to play on this podcast, you're the scientist. Right? And what qualifies you to be the scientist? So tell these people just your background a little bit.
I was a professor for 15 years, and I had NIH grants, and I had a laboratory, and I had fellows and residents, and I was teaching. And I came into the field of urology and men's health, sexual health, with the idea that it'd be fun microsurgery because I have a skill set. And then realized that the field is wide open, and we really don't know a lot scientifically about men, and certainly about men's fertility. So it's kind of wide open.
So I'm going to play the everyman. So you're the scientist, I'm the everyman.
You're kind of that way.
Okay, well, I appreciate it. How does a guy get into urology? That's what I was going to ask you. Like, how do you pick penises over everything else? Right?
And my mom still doesn't know at 90. She still doesn't know what I do. A urinologist? What are you? And so it's a long road, but my dad was a blacksmith from Czechoslovakia who came and he was a welder in America, and so he was a craftsman, a tradesman, a craftsman. And I always thought I wanted to do something with a craft, so I was to be like him. So I went into medicine because I was going to go to religion. I was going to be a pastor.
Really?
And I was going to be a scientist, and then I realized medicine is a nice combination of both. And I'm in a very highly charged ethical field of fertility medicine, IVF, Alabama, everything that's going on.
We will be talking about a lot of that on the show.
Constantly ethical issues coming up. And then, so I really enjoyed it. And then I went to medical school, and then I was...
Where did you go to medical school?
Stanford.
Okay.
And I was still undecided. What do I do? And I was going to be an internal medicine doctor, and I was going to be a surgeon, and I did a sub-internship, we call it, where you go intensely for a month. I did one in the ICU in medicine, one in the ICU in surgery, and I said to myself, 2/3 of the people in the medical ICU never leave. And 2/3 or 80% of the people in the surgical ICU leave. So I can't handle all that.
Yeah,
not
being
leaving
here all the time.
And, or just not leaving, patients not leaving. You can really, it's end of life stuff, and it's difficult for me. I'm not sure I'm built that way.
Got it.
But I am a craftsman, so I said I'm going to do surgery because the real reason for surgery is you have to trust the human body to handle what you're going to do to it.
Okay.
And that's really important for me. When I operate on anybody, which is 40 times a month, I have to trust they can handle what I'm going to do to them. And it's a very optimistic field in medicine. And you generally can help people. It's a craft. It really is a craft. And I worked with some of the best surgeons in the world in Philadelphia who just amazed me at their talent. And it was inspiring. And then I go into urology, and I realize these guys are fun. Urologists are fun. They talk about color of urine like wine, and they like, you can't really talk about your field. You can't pound your chest like a heart surgeon. It's a lot of fun personalities. Everyone loves their job.
Okay.
And then I'm in urology, and it's also a wide field. And then I realized I have a skill set with my hands that I can do things that a lot of people can't, which is microsurgery. So I go into microsurgery, which is fertility medicine and reproductive endocrinology for men. And in that field, I realized that, whoa, this is wide open. I mean, most of male infertility, when I entered the field, we didn't know what was going on. There wasn't a lot of IVF and stuff. It was just like, we don't know. And so a lot of it's genetic. I hired a geneticist at the university, Renee Ray-Opera. She blew open the field, and we sort of got really deep into the science. And it was just wonderful to go into a field and do what you love, and also have the ability to make real changes. And I've got some real bucket list things we can talk about that have happened
over the
in the last 30
episodes.
years.
So many great stories. That's part of the reason I've been saying I can't wait to do this, because they're crazy. And I think mine is one of them. So how Paul and I met in the first place was I made a movie about sperm donors, right? And you liked it, I guess.
Yeah, you got me involved. Yeah.
And so,
you asked questions.
Yeah, right. And so
Is this
Paul
right?
came
Should we
on,
do
and
this?
is this how it works and everything? You're like, yeah. And then when it was done, he said, "Oh, I really like this." And what we had made, my wife and I, and my brother was my partner and the director. We made a movie for Squint Pictures called "If I Could Tell You." It was a 35-minute short that we did around a couple struggling to have kids. And guess why I had a good insight in that? Because my wife and I struggled to have our second kid. And when it was all said and done, we said, this is pretty traumatic. And so you mentioned the IVF topic in Alabama. It's very trendy right now, IVF. And even though it's controversial in Alabama, is right now a bipartisan approval rating, right? Yeah. Like both sides are saying, we want IVF, we want family building, right? So this podcast is going to hit on and talk to men who are out there that are trying to get pregnant and build a family. It's going to speak to men that have issues with their sexual function and dysfunction. And so we have show after show, we're going to be able to pinpoint a certain topic and introduce men.
Drill deep. Yeah.
Drill deep. We're going to have guests that you're going to bring some of your colleagues on the scientific side. I'm going to be bringing questions from friends and the everyman out there to say, is it really important for, what's the difference between penis size? Is it important? I was at dinner last night with Jennifer, your CEO and our producer, and her example was the size of one's testicles, right? She was like, so you did a blog or something, and it was like, is it make a difference if the men's testicles are big and small? And I expect that we're going to be talking a lot about testicles on this show.
One quick fact that might be interesting is pound for pound, humans have the largest penises proportion to their body in all of mammaldom.
Really? Mm-hmm. Horses?
No, pound for pound.
So, because
relative to body weight and size, we do really well.
Okay, so I'm going to tell a little bit about why I'm sitting here personally, because I'm not just a podcast host, or I am a man who dealt with infertility. Mm-hmm.
And I have to say, it changed you, and it made you a better person in many ways.
Thank you. I have been totally kind of different person than I was when we first met.
Absolutely. It's a metamorphosis.
That's really the.
I would call that word empowerment.
Oh, good.
Yeah,
I agree, and I think that's what we want to do is empower men to get healthy.
I'm all about celebrating men, the whole unique being that they are.
Yeah. Well, when I met Paul, I weighed 325 pounds. So that'll give you a different show how different my life has gotten, right? So when I walk in and I'm having trouble getting my wife pregnant, right? And I am over 300 pounds. What is the first thing you think when I walk into your office?
One of the largest issues with fertility is men. And one of the biggest risk factors for having a low sperm count and infertility is obesity. And actually, the data is that it's proportional to your weight. So your sperm count is inversely proportional to your weight. Higher the weight, lower the sperm count.
Really?
So yeah. So it's a pretty good correlation.
A correlation of your actual health.
Well, I'm saying for your sperm count.
Oh.
And your fertility correlates pretty closely with obesity.
What you've told me to in the past too is, and kind of what you advocate for, is that men's fertility health and men's health are run parallel.
Absolutely. I remember giving a lecture at Google. I emphasized there, probably for the first time that I've ever heard it, that we often think of fertility and sexual health in men or even women as a orbiting moon of an Earth of health.
Okay.
So Earth is health, and it's a moon like our moon around it. And I introduced the concept that it's not true at all. It's actually a measure of your overall, it's part of the planet. It's not a moon around it. It's not just something that happened to you, too bad, whatever. It's actually integral to your health. And that has precedent with one of sexual health issues, which is erections. So men with significant erectile dysfunction in their 40s have twice the heart attack risk and stroke risk of anyone who doesn't have that problem, which is equivalent to smoking cigarettes. So there's some canary in the coal mine going on with sexual health, and I was the one who brought the biomarker concept to fertility to light.
Man, there's so much we're going to learn on this show. No, that's what I'm saying. Like, I feel like they need the science to back it up. So a lot of men like me don't talk about fertility, right?
No.
We feel like this is a niche that isn't being talked about.
Almost everything in life, death, illness, you have a notion of what it means to die, or, if you cross a green light in the street, something's gonna happen.
Right.
But when it comes to fertility and being sterile, there's no reference point for men ever. They've never thought about it. So I've seen men just not know how to react. It's like the rug's being pulled out. There's no emotion. There's nothing to tap into referentially to know how to act in that situation. It's very profound. And, some of the partners don't understand what's happening, and they're all over the place, but they'll settle down. But I often, I ask that question a lot, and I get these answers that are like, I broke down and cried, and then I was like, I don't know what to do. And it's just, they have no reference point, and it's wild to see that.
So IVF and infertility in general for both men and women is a traumatic experience.
Yep.
At least that's what I would say. And when my wife and I went through it, I feel like she took on the weight of our infertility, right? And it was because we were doing IVF, and there's a lot of focus on the woman, and they take on that. So flash forward 6 years later, Avery and I ended up getting pregnant naturally. Hallelujah. Have a 10-year-old now who's awesome. After we had Kieran, and that was a good, nice success story, you called me one day and said, hey, you want to get a vasectomy? Not a lot of people get that phone call. You say, you want to do a vasectomy. So Paul does this thing called a brosectomy, which is get your guy friends together, come down to Beverly Hills or San Francisco, and get your...
do it as a group.
Do it as a group.
Not at
Get
the same
snipped.
time,
Not at the same time. Not all in the same room at the same time. So Paul says, hey, you're not going to believe this, but Good Morning America called, and they want to do a featurette on the brosectomy, and I need the subject. If you can find a friend that can do it with you, then I'll do the surgery for him. We'll do it on Good Morning America. I am one that is a yes at all times. I found my good friend Marcos, and he was great, right? And we came in and we did a brosectomy. Let me just say, everybody out there, one thing that Paul is known for is the scalpeless vasectomy, which is a microsurgery, like he said, and he just does less.
Less is more. Yeah.
Less cutting.
Right. No incisions.
A puncture instead of an incision. So I had already, like on my HMO, met with somebody, and I'm telling you, the guy's hands were shaking when he was giving me a test. So I said, okay, you're ready to go. We'll schedule you in a month or something for this. And
then I happened to call.
You luckily called and said, hey, you want to do a brosectomy? I said, absolutely. I'd much rather have you do it than shaky hands guy. So we do the brosectomy,
think about,
right? I'm telling you.
Our patients look at me and they say, did you cut yourself shaving this morning? And everyone in surgery says, did you get a good sleep last night?
Right. You drink too much caffeine this morning, doc? So flash forward, we are getting ready to film, or you're getting ready to give me a vasectomy, and you're giving me my exam, and it's a physical exam, so you're touching my balls, and you kind of go...
So I do have a principle that I always examine everyone before I operate on them.
Absolutely,
because I don't want to be surprised.
Of course. And so he's like, hey, and I have to say, when it's your friend, I mean...
Be careful.
We're close. I think you've actually shaved my nutsack. Can you say that on a podcast? I think I can.
Someone did.
I don't know. I think you might have. I think you might have done it. So it's cool. That's how close we are. Not many men have shaved my nutsack. So anyway, we're on the table. He reached down, we give his exam, and he goes, "So you only have one tube? Is that why you had trouble getting pregnant?" And you said that so nonchalantly, like, "Oh, this was the reason." Yeah. So you only have one. I said, "What? Right. You only have one tube, right?" I said, "What are you talking about?"
So then, 1 out of 500 men are born with an absent vas deferens, and it's associated with no or low sperm counts. And if you don't do the exam, you'd never know. And be in the operating room trying to figure out under anesthesia or whatever, when the clock is running, what's going on. It's not the time to figure it out.
So you said, how many tubes? You said, I have no idea. And then you said, how many kidneys do you have? What's that stat? Because I'm like...
So the mesonephric duct system forms the vas deferens and the ureter, which goes to the kidney. If you don't have a ureter, you don't have a kidney. So that in men with one vas deferens, you can be missing one kidney about a third of the time.
So I am laying on a table.
It would also confirm my diagnosis. If you don't have a kidney, then it's probably that you don't have.
And the man that just shaved me asked me if I have
3 minutes
two
before
kidneys.
We're going live.
Do I have 2 kidneys? I said, I have no idea right now if I have 2 kidneys. And then he looked at me and said, we're going to go ahead and do surgery on that one today. If for some reason I'm wrong, I would do a sonogram right now, but Good Morning America is outside. We're not going to do that, so we're going to do one. And if not, come back and do the other one. Yeah. But you said, I'm telling you have one. And I'm just like, and you said, that's probably why you had trouble getting pregnant. And in that moment, my world changed from, this was my wife's issue. This is 6 years later. And the feeling of the weight that she bore through that process when, so I'm appreciative because a lot of our audience members, I believe, are going to be guys that were in my situation that feel confused and desperate about the fact that it is on them. You said, is it the stat 50% of?
Yeah, I mean, if you look at troubles trying to conceive, probably half the time there's a combined factor. Half the time it's female. And half the time it's both, and a third of the time it's just male.
The reason nobody ever diagnosed me was because we were doing IVF, and they just need a sperm for that. Right? And so maybe I had a low fluid count or something, and you might have said, but it doesn't matter. We just need one, right? In a sense. So maybe, but I will say that we'll keep it anonymous where I went, but the story here is that I was never given a physical exam, and yet I went through months of infertility and spent a lot of money. And I know that it's
a third of the time it's the male problem.
Right, but they didn't even check. They just needed me to jerk off in a cup, which I did well.
Make love to a cup.
Okay, so you can see where kind of the context of this conversation, this podcast for me is I'm blindsided by the fact I just went through all this process and didn't know that I was the issue. And like you said, I said, when we had the surgery, I weighed 325 pounds. And I never once thought it was my issue. So I want every man to know that their fertility, reproduction, it's a team sport. There's going to be a lot of men talking to us that are family planning. Right. There's probably a lot of women that are going to listen to this podcast and hopefully recommend it that, hey, there's a couple guys out there that actually know what you're going through. Right. I want to focus on mental health, as I know you do too. Mm-hmm. We'll bring it.
I mean, if you just look at the guilt play, how it changed, or the responsibility of stuff, it's like, I didn't know I was part of the problem. It's amazing that it changes everything, right? It's because it's infertility is the rarest disease because you treat the woman for a man's problem, and that I don't think you do that with any other disease. If you have cancer, you get treated. If any other disease, you don't treat the opposite sex for your problem.
That's fascinating, though, if you think about it.
It seems a little bit off in the worldview, my worldview.
IVF is only 42 years old, by the way.
Right.
So the conversation and the reason why I don't think there's a lot of knowledge and men even consider their fertility, which is crazy, by the way, that we get married, we partner up with people with full expectation to procreate together, right. But we don't find out if we can before we do that. Mm-hmm. That would be a nice prerequisite to a lifelong partnership.
Yeah, we could have several podcasts on the fact that if you got checked out before, you learn a lot more than about your fertility. You learn about your overall health. You have a trajectory. It's actually a trajectory of health. This is the ovulatory cycle of men.
And women, they have that focus on them from puberty, right? But men don't. Men get their first sexual examination on Good Morning America when they're 40-something years old, right? What would you advocate for then? What is... Can men come in and just get their fertility checked?
This is a larger problem, and it's cultural in America for sure, and probably around the world, because I am the GUY gynecologist for men, but we don't have any gynecologists, GUY gynecologists.
Love
right?
it. Gynecologist.
So, boys grow up with pediatricians, and that goes well. At 16, they're out. They go to work, to school, and they're out of the system. They're every branch of medicine in America is siloed, right? So there's internal medicine, there's endocrinology, and there's surgery. And you don't really see them after that until it's life-threatening, or
There's
it
a
hurts,
problem.
or someone they love tells them to do something, which is the key for fertility. If you want to get a guy to do something, just to have his partner say, do it for me. That's the best motivator. So that's the problem. There's no, and they don't have a measured cycle like a woman's menstrual cycle, which would be nice. But I think there are things we can figure out. Waist circumference is probably a good one. And I take that on every patient in the office, and I'm going to do this study to correlate it with their health, because that's abdominal belly fat is a really good measure of health in general, and metabolic health, essentially. And then, a semen analysis, maybe a testosterone level, maybe a combination of the two. It's all being worked out. We need a biomarker early on.
Do you think...
Long conversation.
No. Well, so again, many shows ahead, and we will have specialists that will come in, and we'll just try to talk about... Yeah, teaser, and there it comes. You advocate for preventive health and medicines, but you're also a fixer, right? That's where the surgery comes in. That's where the expertise in the years. Tell everybody what sperm mapping is really quick.
In men who have no sperm in the ejaculate, you can still be a father, a biodad. And the way that's possible is because you actually make more sperm than you ejaculate. So can you tell me if there's any coffee in this mug? I'm shaking it. You can't. But there is. And so that's the story with the testicle. You make more sperm than you ejaculate, and there's a reservoir effect. So that's the good news. So even men with sterility, no one can find it in their semen or ejaculate. You can have it in your testicle, and that's usable with IVF.
Okay.
The problem with it is that it's not everywhere in the testicle. It's in patches. So it's difficult to find. And there's several competing technologies. So I was against the wall as a professor with guys coming in who were sterile, had biopsies, and didn't show anything. And they said, is there anything you can offer me? And I said, yeah, you can look all around the testicle without hurting it with needles. If you do biopsies, you might kill it. But if you could do something non-invasive, so it's a GPS technique.
Okay.
It's a non-surgical way of figuring out where the pockets of sperm are in the testicle in the office under local anesthesia. And then either you're a candidate for it or not. And it's been magnificent.
I can guarantee you that every man that's out there listening has no idea that this kind of procedure is out there for them when they're having trouble getting pregnant. Like you're out there to help a couple in some way start a family, and even by GPSing a single sperm in their testicle. Right. So then you go in and extract that. That'll be an episode, because it'll be one that I need everybody to
after lunch kind
of a thing. So I want to just take a second and talk to the guys that are out there and go, we really do want to hear from them. We're going to have various segments where we ask questions from them. Perhaps some of our friends, maybe some clients, if they're willing to come on, will give their stories. I know there's a million great stories out there from guys like me that go, what do you mean? How many kidneys do I have? Right. And really they just, their wife or their partner they can't do anything about it either. Right. And that's what I felt with my wife, Avery. When we were going through fertility, it was like, I can't help, and I can be supportive. And I know the partners in that process sometimes feel helpless. So I am used to giving women and females that kind of sympathy, but I'm hearing through you that men are going through it.
You also changed and started taking responsibility for lots of things, for what was happening with your fertility, for your own health, for your partner's health, for Avery's health, for your kids' health. You're a different man, and it's that's the transformation that I've seen with men with this simple problem of infertility when they're younger. If you can change the course of their life, then you're making a big, I think you're making a big, a big advance in medicine. I see couples is much simpler than that. I see couples with low sperm counts and they're not conceiving and they're smoking or they're vaping nicotine, and that can mess up with your sperm count, but also mess up with how sperm work, right? So it may not work well, and it's a male thing. And I tell them, you need to stop smoking. You need to take an antioxidant supplement. You need to, these are lifestyle things, and that should do it. And then they'll call and say, thank you very much. My wife's pregnant. How can I thank you? I said, you don't have to, because you just stopped smoking. Now you have a family you're building, and you've stopped smoking. I just added 5 or 10 years to your life. That's enough.
That's awesome.
That's the plan.
Yeah, I mean,
I'm not happy with the fertility and the kid enough. I want that guy to do that 360 like you did, and say, I got to do better than this.
I love it. Yeah, my life is not what I thought it was going to be. After 5 years, it's not. Like, it's kind of nice to be a different person, and so thanks. I appreciate. Seriously, like, you might not have.
It's my job.
So the first time we actually met was during Fertility Awareness Week, and this is about 8 years ago, and I had just done this movie about anonymous sperm donors, and we'll do an episode about there are anonymous sperm donors out there getting women pregnant without the use of people like Dr. Paul Turek or sperm banks and such. So we made a fun movie about that. So
that was an intense movie.
It is.
That was intense. I mean, that's what drew me to it. You tapped into every emotion beautifully, the way couples go through this.
Well, thanks. What we found is that the fertility industry, the marketplace here in LA especially, saw it as a cautionary tale of what not to do, and at the same time, which is, don't go behind your husband's back and sleep with somebody else to get pregnant, and then they just gave away my movie. I'm going to move on from that. So tell me about the myth or not myth about smoking marijuana when you're trying to get your wife pregnant. Is that a real thing, or is that just...
Absolutely, it's a real thing.
So why?
So pot is worse than nicotine, because you take it in and you feel something and then you stop feeling it, but it sits in your fat and it recirculates over a month or so. So it's the same effect on sperm function, on sperm numbers, on sperm movement, but also deeper into DNA fragmentation. So it's unfiltered, and it sits in your fat and recirculates. So although you don't feel it mentally, it's still there for a month.
And it's slowing your sperm down. So so really quick, because we have time, give me the 3 kind of distinctions of sperm: motility.
So on a semen analysis, you have the volume of the semen. It won't change that. The concentration of sperm, it might change. The motility or movement, it will change. And then the function is a deeper thing, which is, does it work well? Is it a soccer team that it looks good, but do they actually work well together?
Score goals, so to speak.
So is it a championship team, or are they duds?
Go ahead and regardless of how pot affects it, what does motility mean? Like, what are those
percent of sperm in the sample that are moving, which is the fraction that's going to do the job? Right?
Okay.
If they're just sitting there like parked cars, it's not going to
do it. And then the shape of it is important.
So shape is one. It's called morphology. It's a little hard to do well. It's not like a glucose level. So first of all, semen analyses are not like measuring anything else in your body, because it's biologically so variable. I have a great blog on this called Reading Your Cards, and I think of the semen analysis as a poker hand, and each value, concentration, volume, motility, shape, etc., is a card in a poker hand, and they each have a meaning independently of each other, and they have a look. Is it a royal flush? Is it a straight? And so I look at it two ways. Maybe it's just me, but I look at each of the individual numbers can reflect something, but the look also has to be very characteristic. So normally you would say a semen analysis is not a diagnosis. It's just a sign, like, I have pain somewhere and this, and then you come up with a diagnosis. But I think if you look at it from that point of view, you can often figure out a problem.
Oh my!
So that's the level I take it at. So they are meaningful, but they vary a lot, like 100%. So you can have a man who's normal one day and 3 months later he's zero, and that usually is due to habits or fevers or things like that. But even normal fertile men can be low. And it can vary a lot. So you have to have a series of them. You have to look at it over time, look at it in perspective of their health, because it's not as simple as a glucose level, which is very precise.
Do you think that, I'll say this. So a friend of mine yesterday texted me and said, have you ever had your testosterone checked?
Yeah.
He's my age, 50. And
looking good, Rob, looking good.
Thank you. And I said, well, ironically, I'm going to be talking to one of the foremost men's fertility specialists, and I'll ask him. So how important and what is your range of testosterone? And I think that's going to be a topic when we consider the sex.
Testosterone in a nutshell is oil in the car. And if you don't have any, you're not going to run well. Does it kill you not to have it? No. It's sort of like sleep. Your quality of life is very different if you don't have sleep, but it won't kill you not to have sleep. Testosterone's oil, not gas, but oil in the car. It won't run as well, and you won't last as long. It'll wear out faster. So if you look at good long studies, like at the VA hospitals, where they take men and look at their lifespans with normal testosterones and low testosterones, the men with low testosterones don't live as long. They die earlier, not of anything specifically, maybe broken bones because their bones are weaker, but sleep is, there's oxygen, sleep, and testosterone in terms of importance in life. Maybe sex is in there somewhere.
Sex is in there somewhere. We're going to be talking about that too.
All right, we'll do that.
Would you then say that?
So there's a normal range. It varies widely. It varies widely during the day. And if you're diagnosed with a low T testosterone, you want to treat it, you would want a symptom to go with it. My sex drive's down, my erections are bad, my energy's down, my muscle mass, etc. So you always want a finding in addition to that lab to treat, because having a low T imitates a lot of things like age. Aging is a similar set of symptoms, and thyroid issues or diabetes can be similar presentations.
So yes, you're very much a preventive person, telling people like me to get their waist down, to stop smoking, to start with your own health, which is kind of, when people come to me for advice sometimes, like whatever it is, I get this from my wife, I say, the first thing you need to do is lose 50 pounds and then come talk to me, right? Because I will say that getting healthy and or clean is the first step to your mental, how you're going to take on this fertility mentally. If you're doing it in vices and things and not letting those go, then you can really show me your commitment to how bad you want to have fertility health by how bad you want to have health.
Yeah,
right?
I think it goes both ways. I think sometimes that mental turnaround, reversal can lead everything else. It might have been the case with you when you realized, oh my, look what she just went through. Look what Avery just went through, and look, it's my issue, and
right.
I didn't know. So it can be mental strength leading to physical improvement, or it can be the opposite.
But what I like
But you need both.
What I like about your practice and your advocacy is for the men's health, so that you don't need me.
Right. I have a unique practice in medicine, because there's no model in medicine in America that fits my practice for sustainability, because it's essentially non-sustaining. I see you, I figure out what's going on, I do a root cause analysis, and I cure you. And then you're out of the practice. So every other practice has a recurring population. And I love my recurring population, testosterone guys, the older men with prostate issues. But I am aiming to cure you and empower you. And I don't want to be someone you call a time for help or something. I want to be able to give you the resources to get it done and have you out of the nest.
Do you know that I still don't know if I have one or two kidneys?
That's okay.
I might.
You can't donate one without knowing.
Okay, good. So, but essentially,
So
I'm all right.
It's okay because if you have one, it's twice as big as you would if you had two.
Really?
Yeah. So they grow to twice, so it's doing the same work.
I only have one tube, so that's official. But I don't know how many kidneys. I haven't had a new sonogram.
It's okay.
Okay.
If
So
you get kidney stones, you got to go right away. You can't wait.
I'm looking at Mark. So that camera guy right there, Mark. He just passed one last night.
Yeah, so you
He's
can't
here.
wait. You can't wait because if you block one kidney, it's trouble.
I'm so scared of a kidney stone.
You are.
Yeah, they say it's
It
like
is the male
giving birth.
baby. It is. It is.
And it's just the actual
I
pushing
had my
through
first
the
medical problem a couple years ago on a flight from LA to San Francisco, and I had a lower abdominal pain. It's an hour flight. It was in the winter, so it was rough. And I said, "Boy, I've never had that before." And it's at McBurney's point. There's a point down there called McBurney's point on your belly, and I was like, "It's not."
McBurney.
And I said, "Oh, that might be a stone." And then I thought about it, and I was going to go to work the next day, and I said, I'll probably be fine. I'll just hydrate a lot. And the plane probably made it worse because it was so rocky. And then by the time that plane landed, I'm like, I'm not going to work tomorrow. I'm going to ER right now, and I'm going to get some help for this.
Did it
in 1 hour?
What do they do? They just give you fluids and say pee it out.
Well, they give you pain control, but I didn't need any opiates. But it was really, yeah. And then you have to. There's 3 points where it can hang up, and each of those will reflect a certain pain. The one up high, it's in the back, and down low, it's between where the ureter, the tube joins the bladder. That's where mine was, because that's McBurney's point. So just had to get through. That was the last one.
I love it. McBurney, that guy.
Yeah.
He's known for his
self-diagnosis. Like, I think I'm okay. And,
is McBurney the doctor or the patient?
I can't remember. I like this. That neurology, the oldest surgical tool ever developed was a Van Buren sound, and it's literally a piece of metal that's shaped like this, made of silver, and it's Egyptian. It's called a sound now, but it's the simplest thing you can imagine. And you can see it on hieroglyphics. You'll see, and what they did was they put it down the penis, and they would, if you have a bladder stone, which some stones get big and sit in the bladder, it would tap it and you hear ting, 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 and then that's how they diagnose bladder stones.
In Egyptian times?
Yeah.
Okay.
It's called a sound. It goes ting, ting, ting.
What is
You're getting uneasy there, Rob.
I am. I don't like talking about it. And when we get to the sperm mapping,
okay, so let's talk about stones. The number one thing you can do is drink fluids.
Okay.
Right. So if you don't have a history and things like that, so every 8 ounces per day more you drink, your rate of stone development is 10% less.
Okay. All right. Good to know.
There you go.
Yeah. Mark's like, me?
Water?
What are you looking at? Where's my water?
Where's that water? And then if you have another one, you need to get a metabolic evaluation of your urine to see what risk factors you have, because maybe it's all the cheese you're eating or oxalates or leafy green vegetables or chocolate.
You're a healthy eater, Mark. He's like going, yeah, he's a healthy eater. He's in shape, at least.
But this is the preventative side, right? It's not all about reacting to it. It's about what can we do next to stop this next problem.
Another thing we're going to talk about on this podcast is Forhims and other medications that are now I can go on my phone right now and I can get medication for premature ejaculation, apparently I get it for, so I want your opinions on
There's
all
4
these
types of ejaculatory disorders.
Okay. And what are they?
Well, there's early, late, backwards, and not happening.
Backwards ejaculatory.
Yeah. Men with diabetes, testis cancer, other kinds of neurologic diseases will have a normal erection, and they have a normal climax, but it's dry.
Okay.
So I had a patient this week from New York who came in, and lifelong no ejaculate. So everything works fine, but when it happens, nothing comes out. So it's dry ejaculate. And everyone thought it was retrograde, meaning it went into the bladder. It's a 2-way street into the bladder because it's shorter, or out the penis, which is the longer way.
Okay.
You have to close that valve to do it. There's a valve there, and you don't have control over it. But you pee and ejaculate through the same tube, so there's 2 different sphincters. They have to act differently with different actions. So everyone thought it was that, but there was no sperm in his bladder because you can check that. You just have them pee after they ejaculate, and if there's sperm there, you know where it is. And so I diagnosed him with ejaculatory duct obstruction. So I just treated him, and he is, for the first time in his life, is 35 or 40 years old. He's having an erection,
something,
climax, and something coming out.
Wow, interesting.
So I think that's a transition, sort of like yours. I think that's going to happen. We'll see.
This has kind of been an anonymous. It is very anonymous, this industry. So if I come in, men and women want their anonymity when it comes to this, because it's a bit of a taboo to say I'm infertile. For guys, a lot of I didn't really.
It digs deep.
It does, right?
It digs deep into them. Yeah.
They have an issue like, am I a man, or I can't get my wife pregnant?
And
very
that's
old
the issue of the ego, superego, that you've never really thought this would ever happen to you. You never even thought about it.
Yeah.
And that's why it goes so deep, and no one wants to talk about it.
Yeah, so
there aren't many champions in the field.
So we need to tell stories of people that aren't. We're not going to say who they are, but my hope for this podcast is that men are going to come out, so to speak,
Right.
and talk about their sexuality and talk about their lack of fertility and say, "Hey, I need to be vulnerable here and talk." Why? Because there's thousands and thousands of men out there that need to know that this is a common
your partner's
thing.
getting treatment that may be unnecessary because of your issue.
It is two ways, like, right? So it does. You said something today that we're going to have to talk about. Age matters.
Yeah.
It matters in women for sure, but you're saying it actually matters in men.
Here's your teaser. We've never, as a species, been old enough to conceive at the ages we are in history. Right?
Really?
So the average age at death in 1910 was around 58. The average age of death in 1960 was around 70. So for 2 generations, we've lived to what we might call older paternal age, right? So 2 generations. And all the things, there's a lot of stuff happening with sperm as men age. We'll talk about it. But that's a brand new issue in the species. And I figured it out like 10 years ago. It's like, why is all this happening? And the answer is, we've never lived this long before. And we've never been fertile this long before. And we necessarily weren't made to be fertile in our 60s or 70s. So it's a really active issue. And there's a lot going on with genetics, epigenetics, proteomics, metabolomics.
All the science stuff
Yeah.
that I don't understand, and you're
I'll
going to explain to
it
all of us, right? Okay, so good. That's really my call to action for the men and women listening out there.
That was another teaser. Wasn't it?
That was a good teaser. Get vulnerable. Call,
get
let's
vulnerable.
like, follow, and subscribe to our podcast. We're going to be on YouTube. You're going to see portions of it on social media, of course. We're going to be wherever podcasts are heard, Apple Podcasts, iHeartRadio, and the various places. And I want them to follow us. I want them to like and subscribe and help us make this podcast successful, because we kind of have a mission here.
We're going to tell some secrets.
Okay.
Big ones.
Big secrets.
Secrets of the species.
And stories that will be detailed and fun and scary
and relatable.
And relatable. We won't say who they are, but I bet that there are people listening right now that do have a doozy. They have stories to tell, or they have...
And if you think about it, they can't tell anybody. They're not going to tell their parents. They're not going to tell their buds on the golf course. They're not going to do, they'll tell their partner potentially, and that's it. They're locked down.
Man, that's huge. We, when Avery and I were doing this, we likened it to, it's terrible, but when you have cancer of some sort, you tell people, and everybody says, fuck cancer, and you talk about it, and right, and you have a small group, and you have a certain kind of cancer, and everybody's concern for you, and you have support, and you're going through that. But when you're going through infertility, nobody knows.
I'll tell you one fact, and this is what I love about, I'm going to bring it back to the movie, if I could tell you, that you did, is that what hit me the most was the profound, deep, emotional play you had there. You hit every chord of the deepest, you touched everything, was just incredible. Avery did an amazing job on that, and everyone did. And I think at one of the premieres, we talked about it. I said, if you look at, I'm going to bring the cancer thing into it. If you ask cancer patients how many years of their life would they give up to be free of cancer, to be cured of cancer, it's about 6 years on quality of life instruments.
Okay.
I did a formal survey of my patients as a professor at UCSF, and I asked them all those questions, the cancer. I didn't publish it, but I did ask them, and I got, how many years of your life would you give up to have a child, to have a family? It was 5.7, which taught me one thing: the impact of fertility on young couples is the same impact of cancer on people, on individuals. And I think I said that at the thing. It's just profound. And no one really realizes that.
I'm not reacting because that was the best clip. I mean, that is poignant. To say that you're judging how much years you're willing to give for something, and it's the same as cancer.
Yep.
I would say that in the moment, and what the movie tries to show is how far you will go when you are desperate.
Right.
How far will you go? And yes, by the way, there's a documentary out right now, series I feel like it's based on my movie. It's not, but it's about anonymous sperm donors, like we talked about, that are doing that, and how desperate people go. That's what the movie's about. Kind of fun. My wife did star in it, and she is incredible. And
you led the way.
And the reason, and the birth of this,
you
and
won something for that, didn't you?
We won some. Hollywood? We won some. Yeah. A couple of awards, and we just last April.
No cans though, right?
Not cans. No. They're all getting back from Cairns this week. I'm so jealous. I want to go to Cairns. Let's make another movie, right? Actually, we were at the New England Fertility Society event last April, and they asked us to rescreen, if I could tell you. So we screened it in front of the REIs there, and good. REI stands for
reproductive endocrinologists.
So these are the doctors that are doing IVF doctors, right? And so we screened it in front of them. It's way more relevant today than it even was 10 years ago, Paul.
Oh wow, yeah, it's
right
true.
Because of the way the world is. Even it's getting less and less religious. It's getting more partisan, and so
polarized.
Yeah, the way that I have heard, or I view you in this industry, is that people like what you're out to say. That your colleagues, your peers are pro what we're doing. Mm-hmm. I just don't think anybody has really had the balls to do a show for just men and say, "Hey guys, let's have a roundtable discussion about our fertility and our sexuality."
Yeah, I mean, that's exactly right. I went from a professor publishing papers on science to a private practice physician writing blogs every week that would relate to the everyman. Mm-hmm. And your movie is what medicine misses. It misses that whole aspect of emotional health. IVF is not easy. Mm-hmm. And I think it's what Western medicine kind of misses is the whole individual.
Well, there's our first podcast.
Couple of teasers. Many
more to come. Please support us by watching, telling people that this is going on. Feedback. Ladies, please invite your husbands or partners to listen to the podcast. And I'm telling you, team sport. And I'm telling you, they can trust that I'm going to be pretty open and vulnerable, clearly, about my own stuff. And I'm willing to go there. And if, I don't know, I think there's going to be some people that coming out and talking about their issues in fertility because they know this is a safe space for them.
It's vulnerability leading to empowerment. Because being in the dark is not healthy. Information can be very valuable.
Hear, hear.
Thanks for joining the Talk with Turek podcast. Today's show was executive produced by Rob Clyde and Jennifer Harris. DP was Mark Christian, engineered and edited by Drew Unser. Thanks to Avery Clyde, Shen Heckel, Max Flora, and Jonathan Raju. Talk with Turek is produced and recorded in Los Angeles, California, in association with Hey Babe Media. Subscribe to our show wherever you listen to podcasts and watch us on YouTube. For more information or to book an appointment, whether in person or virtual, visit Dr. Turek online at theturekclinic.com or call 1-888-TUREK-MD, TUREKMD. Don't miss our next episode as we delve deeper into men's fertility and sexual health on Talk with Turek. And be sure to follow us on Instagram and Facebook at Talk with Turek for updates and more content.